Why does the male urethra have a dual role? Imagine a single tube that handles two very different jobs in the body. That's what the male urethra does. It's a fascinating part of our anatomy because it serves both as a passage for urine and for semen. This dual role is a direct result of how male anatomy is designed, combining functions of the urinary and reproductive systems into one pathway. To understand why, it helps to look at the urethra's structure. It is a muscular tube that starts at the bladder, which stores urine, and runs all the way through the prostate gland and along the length of the penis before opening outside the body. In males, this tube is much longer than in females, who only have a short urethra that carries urine. The male urethra is divided into sections: the prostatic, membranous, and spongy or penile urethra. Each part has specific features that support its dual functions. The prostatic urethra, passing through the prostate gland, is especially important. During urination, urine flows from the bladder through the urethra and out of the body. During ejaculation, semen, which contains sperm from the testes and fluids from the prostate and other glands, travels through the same channel to exit. The body has mechanisms to keep these two fluids separate. For example, the internal urethral sphincter at the base of the bladder closes during ejaculation to prevent semen from entering the bladder, which is a process called retrograde ejaculation when it happens unintentionally. From a health perspective, especially when considering bladder health and bladder cancer, this dual role has important implications. Because the urethra is exposed to both urine and semen, it can be affected by infections, inflammation, or tumors that originate in either the urinary or reproductive systems. Conditions like infections or tumors in the urethra can sometimes impact bladder function or increase the risk of complications. For instance, bladder cancer can sometimes spread to involve the urethra, especially if the tumor is near the bladder neck or in the prostate area. Knowing how the urethra works helps doctors diagnose and treat these issues effectively, whether through procedures like catheterization or surgery. It's also worth noting that, because the urethra is exposed to both urine and semen, it can be a site for sexually transmitted infections. These infections can have effects on both urinary and reproductive health, making regular checkups and prompt attention to symptoms like pain, bleeding, or changes in urination very important. Maintaining urethral and bladder health involves understanding this anatomy and seeking medical advice when needed. In summary, the male urethra has a dual role because of its unique pathway through both the urinary and reproductive systems. This design allows it to carry urine from the bladder and semen during ejaculation. Recognizing this helps us understand how various conditions, including bladder cancer, can involve the urethra. Always consult healthcare professionals if you notice symptoms or have concerns about your urinary or reproductive health. Taking care of this vital structure is key to overall urological well-being.